So refresh our memory on your history. You have stenosis.
Yes.
Tell me a little bit about
It's a recent diagnosis. I was having issues. I do a lot of biking, like I said, and I did the ride across Iowa last summer.
Okay.
It's about 500 miles roughly.
Sure.
And after that, I don't know, I couldn't feel like my toes on one foot. Then I kind of went over the other foot and both feet.
Sure. And does that
And
stay all the time, or it comes and goes depending on activity?
yeah, it's different every day.
Do you notice patterns and positions?
Not so much. I've been doing like a lot of sit-ups and stretches and stuff, so that's
Okay.
helped, I think.
Sure. Are you better when you're standing, walking, better when you're sitting?
It varies. It's probably better when I'm sitting,
Okay.
but
Yeah, kind of.
unless I'm sitting in the car, then I have to get up, like
Sure.
you mentioned, like every hour or so. I'm driving up to Minneapolis or something, and
Yeah.
it's like 3-4 stops before I get up there. So
Yeah. Well, I'd like to, if you don't mind coming on up,
Sure.
we will take a peek at how your spine moves, how your hips move.
okay.
So you feel it in your feet and you feel it in your back as well?
Mm-hmm. Sometimes it's Riding all the way down.
All the way down.
Mainly
Usually
like
numbness in the feet.
mainly like my feet, like typically my big toes,
Okay.
and then sometimes it's like middle toes on one foot, big toe on the other.
Sure.
Kind of varies.
Varies.
Yeah.
All right. So I'm gonna bring you through a variety of movements. Right now, what are you feeling?
Feels pretty good for
Okay.
the most part.
So I want to know if anything feels worse or if anything feels better as a result of these movements. First, I'm going to have you bend forward, reaching
Okay.
toward the floor. What does that feel like to you at that end range?
Feels okay.
Pretty decent mobility. Just one more time down. So just close to touching the toes and a little
Can't get
stretch
my-
in the back of the legs.
Yeah, can't get my hands flat or anything on the floor, but
If I had you put your hands on your hips and bend backward.
Okay.
What does that feel like to you?
That's okay.
Does that change anything in your back or in your feet?
Not so much.
If I had you side bend.
You feel like a little pull over on this
Pulling
side.
over there. And then we'll see the other side.
Oh, it's more of a pull on this side.
Okay. Painful pull or mostly just stretching?
That's kind of a little bit of a pain.
Okay. I'm gonna have you do, we'll keep it in here, just a couple laps of walking just back and forth.
Okay.
And try to walk as you normally would.
Like no one's staring at you.
Yeah. Yeah, try not to show off or change anything. One more time back and forth.
Tuck-footed or like bow-legged or something.
So what I'd like to do is assess if there's any contribution from the hips related to this.
Mm-hmm.
I'm gonna grab a pillow here. I'll let you lay on your back. Are you comfortable on your back?
Sure.
Any positions that aren't comfortable for you? If I were to want you on your stomach, would that be comfortable in the future too?
No, either way, that's fine.
So just kind of checking out hip mobility. Does your pain come into your hips or is it mostly lower in the legs?
It's usually lower feet for the most part.
Bring it out here. Does this change anything for you?
Not so much. A little bit of a pull down here, but
Tightness and rotation, but
It'll make you feel better.
all just comfortable stretching
yeah,
right now.
yeah, that feels okay.
And take a peek at the other side. So was your spinal stenosis diagnosed by X-ray?
Yeah, actually MRI,
MRI.
and then he went and retired. Sent me to a different doctor.
Sure. Have you done any other treatments for it yet?
No, all he really said was just get one of those shock posts for my bike,
Okay.
and activities, do some exercises that I found on the internet, that was
Sure.
about it.
A little tightness and rotation with both sides. So that would be something that, as a part of a comprehensive plan, we definitely want to address the hip mobility for
Mhm.
you. But I think for the sake of our demo here, we'll show some joint mobilizations to the spine to work on getting that specific spinal mobility. We have just hunt down a towel. I think we've got some right in here. Alright. So you said you are comfortable laying on your stomach?
Mhm.
Okay, so have you remove your glasses and we'll do a 180 here. And make that transition and drop that down. Drop these down. We'll slip this towel right here.
It's down here, is that alright?
Yeah, that's just fine. So I won't step on. There we go. So you can feel free to rest your arms down there.
Mhm.
Lift your feet up. Lift up here, both feet.
Oh,
Okay. And lower back down. Does that position feel okay to you?
Mhm.
Okay. So what I'm going to do is start near the upper spine and I'm going to gradually work my way down, giving some pressure through each of the levels of the spine. I want to know what you're feeling, if anything feels more tender, if anything changes your symptoms. Just make a mental note of if you're having any symptoms in your legs or feet right now, because if that changes, I would want to know.
Okay.
Kind of work for a little tender there.
Yeah.
Do you get pain up here?
Mhm.
Yeah. How's that feel?
It's okay.
Tender?
No, it's alright.
Not as much as that one level.
Mhm.
Here we're getting close to the bottom of thoracic. And into the lumbar spine. How's tenderness as I'm pushing here? So, did you feel that just, we saw that, did you feel that just locally, or did it send any symptoms down your leg?
Yeah, it went right down my leg.
Alright, so
Is that like the
that is exactly,
T4 or something? Is that what they
so-
call
we're lower, we're in L. We're in the
it? Or
L's.
maybe it's L4? I don't know.
Yeah, we're about L4, L5.
Okay, yeah, I think that's where you said it was a problem.
Yeah. So, was it down the right, left, or both?
Both.
Both, okay. So what I'm gonna do is give a little bit of a joint mobilization here. If that changes anything in your leg, if it comes back, I wanna know, but where I'm focusing now is on the sides of the spine.
Yeah, okay, alright.
Butt up a little higher, just gentler.
Feels okay right there.
So you wanna find that right intensity for you where it's pressure but not irritating. Sometimes as a part of our evaluation, we reproduce your pain. That gives us a lot of information about where your pain is coming from, but throughout the duration of treatment, it shouldn't be painful. I'm feeling lots of tight muscles in through here.
Mm-hmm. The massage person always tells me that.
Yeah, definitely joint contribution, but also muscular contribution to your pain. How often do you go for massage?
For a couple of months maybe.
Okay.
I can afford it, I go every week.
Yeah, that'd be nice.
And what have you been doing for your own stretches so far?
Uh,
Said some sit-ups. I remember that.
doing the thing where I grab my feet on the side, like bring it back toward my head,
Sure.
and then different types of cross-legged muscle stretches. Like where I put one leg over the other one that's
Figure 4. Yeah.
elevated a little bit, or not elevated, but
Yeah. I got you.
on the floor, and then kind of bend it and stretch it a little bit.
How's that feeling as I'm working through those levels?
Feels okay.
Good.
Haven't hit any bad spots yet.
So, when things are stiff globally, I find a lot of benefit from working through everything. Because especially with this L5 level,
Mm-hmm.
when everything's stiff, that L5, L4 area are put in a position that puts them on more strain.
Okay.
Whatever these segments can't do, all has to happen here, and that can make us more prone to that degeneration at that level versus other levels. I'm sure there's statistics, but the lower levels of the lumbar spine are far more vulnerable to spinal stenosis and degenerative changes than the upper levels.
That area there, I'm kind of feeling it in my butt.
Okay, so it's all connected, right?
Mhm.
And we definitely know that your pain in your lower extremities is coming from the upper. Is any of that sending it down when I'm on the side of it, or just when
Yeah.
I'm centered?
More so on that side, on the
What
right
about
side.
over here?
Not so much.
Does it change anything?
A little bit. Definitely down the right side though. Just,
Yeah. So sometimes getting the rotation of that vertebrae from the other side. I do think working hip mobility becomes really critical in spinal stenosis. Making sure that you can extend all the way through your hip so that it decreases the strain on the lumbar spine in full extension. How are you doing here?
yeah.
No
I'm
tendon?
still feeling some pain on the right side of my butt.
Flex that up. Take that extension away. Does that feel better?
Mm-hmm.
Last thing I'd like to check out on your mobility is how that hip extends. Because that may be one of the missing pieces to your mobility. I see it very commonly.
Yeah, I
So-
seem to have like more issue with the hip on the right side. Cause I've, when I ski with my sons, I've wiped out a few times on that side and
Sure.
had to get shots of cortisone.
Okay, into the hip?
Yeah.
Or into, yeah. So that makes sense,
Actually,
right
both
was-
my hip and shoulder a few times.
okay. Let's get you onto your left side then. Allow me to take a peek at that right hip on top. Just lay on your side, this will be the last thing we take a look at.
Dr. Jessica, when he was laying on his stomach,
Yeah.
even though it's his right side that's affected, wasn't he rotated to the left?
He was a
Right,
bit,
Yeah,
yeah,
I could see it.
yeah. Alright, so bringing lower knee up within your comfortable range, what I'm gonna check out here, and I'm gonna ask you to fully relax, which is easier said than done. Is how this right hip extends. You starting to feel some stretch there in front of the hip?
A little bit, not a whole lot. I sheared off my tibia like back in 2009.
How'd you manage that one?
My tree stand collapsed on me up in the UP.
Relax.
What
And,
happened to the tibia?
The tree stand collapsed and there
And
was a fracture.
I broke off the side of my tibia,
Hmm.
and they like screwed and plated me back together.
Is that supportive enough for you?
What's that?
Is that supportive enough for you?
Yeah.
Alright, try to just drop this leg down.
But that, it seems like I've got some nerve issues around that too. Like
Yeah,
the incision.
so definitely some tightness in through hip extension.
Mhm.
You're feeling some of that front of the hip area.
Yeah, when I do that exercise where I pull that backwards.
Yeah.
Yeah, I can really feel that.
Yeah.
Especially the front.
So that would definitely be a part of a comprehensive treatment too, is managing that mobility.
Mhm.
Can imagine we can backward bend by extending through the hips, but also by extending through the back. If the back doesn't extend well, we need more through the hips. So, some specific stretching through that would be a part of the thorough plan of care, but also, I mean, looking at all of the nerve contribution to everything,
Mhm.
looking at how feet and ankles may contribute following that history of fracture.
Yeah, I mean, he said it wouldn't ever be like 100% again, but it's probably like 90, 95 for the most part.
Sure.
One point, I got a bad staph infection. They were actually gonna amputate my leg from like the knee down, but
That's scary.
yeah,
Oh,
but they were able to save it, so.
You've been through a lot.
Yeah, it's
Let's
just-
see you sitting back up here.
It's just one or two things.
Wow.
Those
I
things
suppose
add
the
up.
list, it goes on and
Got a lot
on.
of scars on it.
Those things add up for sure. How does that feel as I get that pressure through the back?
Yeah, that feels all right.
Even up through thoracic spine, lots of stiffness.
It's
You said
pretty
you get
stiff.
some pain up there too.
Yeah, once in a while.
So a comprehensive plan for addressing your pain, knowing all of these pieces,
Mhm.
has to address not only one, but all of these pieces. Because if we just say, oh, just go get an injection in one of the spots that hurts,
Right.
you're gonna be missing out on a lot of relief and function that are possible by taking this more comprehensive.
Well, and it's only temporary. It seems like, it lasts maybe like a month or so.
Yeah, so we're
Yeah,
actually
yeah.
gonna talk about, there's comprehensive treatments, but
Mhm.
what about everything else, right?
Right, exactly.
What other options, right?
Mhm.
How do things feel as you're getting back up?
Good.
Okay, good.
You just wanted the free massage.
And what?
You just wanted the free
Yeah.
massage.
Yeah, we'll have you kind of test it out, see how it feels while you're doing those.
Yeah, your legs went like that. You expect-
So that tells us a lot about what's going on in your condition
Oh,
and, and exactly where to go from there.